Hi everybody, my name's Dr. Stacey Clift and I'm one of GOsC Senior Research and Policy Officers. And in this second video, I'm going to take you through the CPD Evaluation Survey 2020 to 21 findings. And we're going to specifically today look at objective activity in relation to the osteopathic profession. So what are other osteopaths doing? Overall, between 35% to 60% of osteopaths have undertaken an objective activity during 2020 to 21, and this is dependent on the data source used. So in terms of the CPD Evaluation Survey, we know that 35% of osteopaths said that they had completed their objective activity, whereas when we look at some of our other data sources, such as the CPD self-declaration data, we know up to 60% of osteopaths so far have said that they've completed their objective activity. So what's the most popular activities that have been undertaken? The most popular is case-based discussion, and as you can see, 70% have undertaken case-based discussion. 32% have undertaken patient feedback, and 24% have undertaken peer observation, and 24% have undertaken patient-reported outcome measures, PROMs, and 18% have undertaken clinical audit. What are other osteopaths doing? We know that osteopaths are trying out objective activities, and many osteopaths undertaking more than the required one objective activity. This suggests that if osteopaths try out an objective activity, they are more likely to see the benefit of doing so to their practice and try another type of objective activity as a result. So if you're thinking about choosing the right objective activity for you, you might find the decision tree that's on the screen helpful to look at and explore. You'll see that on the left-hand side, there's a series of questions that you can ask yourself. And depending on how you answer that in terms of yes or no, will suggest the most appropriate objective activity for you and your practice. We also asked in the CPD Evaluation Survey 2020 to 21 about whether osteopaths were using and reporting using our practical workbooks for their objective activity. And as you can see from this, 49% reported using our case-based discussion workbook, 24% reported using the patient feedback workbook, and 20% reported using the peer observation workbook. So if you haven't looked at our practical workbooks yet, we have produced a number of practical CPD workbooks, and 3 of which focus on supporting osteopaths with their objective activities. You might find it helpful to work through some of the following: the case-based discussion workbook, the patient feedback workbook, or the peer observation workbook. We also asked osteopaths in the CPD Evaluation Survey whether they had any concerns about giving and receiving feedback in relation to their objective activity. And as you can see on the screen, on the left-hand side, these are some of the concerns that osteopaths had about giving feedback. And on the right-hand side of the screen, these are some of the concerns that osteopaths had around receiving feedback. So I'm going to just take you through some of those. Feel nervous about my own response to the feedback and whether it will affect my confidence as a practitioner. Might be easy to take it as a criticism. I may not agree with the person or persons giving feedback. I don't know how to do this. Sounds intrusive, feels like exposure. Finding someone suitable who has the right skills is a concern. Giving and receiving feedback skills are a crucial part of both objective activity and the peer discussion review. To find out more about developing your feedback skills, we have developed a dedicated video on this area, and you can find this on our dedicated YouTube page, and the link is on the screen. So what do you need to do for preparing for your objective activity? Step 1. Select an objective activity using the decision tree we looked at earlier in the video to help you make the right choice for your practice. Step 2. Review the information on the objective activity of your choice on our CPD website, and the link is on the screen for you. Use and work through the relevant resources, and that includes the workbooks that we looked at earlier in the video. We also have recorded webinars in each of these areas, and templates for you to record your activity. Remember, it is always helpful to reflect with a peer. Get started with your objective activity. Visit our CPD scheme microsite at cpd.osteopathy.org.uk/getting-started/objective activity. We hope this video has been useful to you, and good luck with your objective activity.